My name is Juan Luis Ontiveros, and I am talking about autoimmune hemolytic anemia, our experience as a center of treatment, and the clinical characteristics of our patients. This disease is rare. Its incidence is only reported of 17 cases among 100,000 persons in the United States. So the first consensus has just been released during this year. It is characterized by the development of antibodies, specifically IgG, IgM, or the attack of the red blood cells by the complement C3. So primary cases are those without any underlying disease, and secondary cases are caused by another disease such as autoimmune, neoplasia, or even infections. IgM cause or complement C3 causes called antibodies disease, while IgG causes warm antibodies disease. So we evaluated 13 cases among these 13 years that we analyzed, with an average age of 59.1 years, with predominantly women among 69.2% of the cases. 7 cases were primary, while the other 6 cases were secondary. Glucocorticoids were used as the first line of treatment in 12 patients, with excellent response, with a global response of 84.6%, complete response of 69.2%, and a partial response of 15.4%. Rituximab was used as a second line of treatment in 3 patients, with a global response of 100%, complete response of 65%, and a partial response of 25%. Just like splenectomy responses that were reported previously in other studies. Other treatments like immunoglobulin or azathioprine also have very good responses. Our study is important because we observed that 2 patients relapsed 4 times, and that their responses to their treatments were worse than the other patients. And these patients evolved to a systemic erythematous lupus eventually. Initially, they had not have any characteristics of another autoimmune disease, but eventually they develop these characteristics and, well, very rebel to the specific treatment of the autoimmune hemolytic anemia. But when we could know that they had another autoimmune disease, they had better responses when the systemic lupus was treated. It's important that at first they did not have any characteristic, neither clinical nor biochemical. So it is important to follow our patients with autoimmune hemolytic anemia during a long period of time, so we can identify when they develop any characteristic of another systemic disease that should be treated as fast as possible.